established to protect civilians in conflict, including patients, medical workers, and facilities. They bring some humanity into what is otherwise an inhumane situation. The Geneva Conventions are not just an abstract legal framework. They are the difference between life and death for medical teams on the front line. They are what allow patients to access our health facilities safely and what allows us to provide health care without being targeted. We know the reality of war quite well. Over 40 years, Doctors Without Borders medical teams have been treating the sick and wounded in nearly every conflict, from Afghanistan to Bosnia to South Sudan and Somalia and Yemen and Syria. It's important to note that speaking out on behalf of our patients and the protection of our medical mission is core to our work. It is precisely because attacking hospitals in war zones is prohibited that we expected to be protected. And yet 10 patients, including 3 children, and 12 of our staff were killed in the aerial raids. The facts and circumstances of this attack must be investigated independently and impartially, particularly given the inconsistencies in the U.S. and Afghan accounts of what happened over recent days. We cannot rely only on internal military investigations by the U.S., NATO, and Afghan forces. Today, we've announced that we're seeking an investigation into the Kunduz attack by the International Humanitarian Fact-Finding Commission. This commission was established in the additional protocols of the Geneva Conventions and is the only permanent body set up specifically to investigate violations of international humanitarian law, such as attacks on hospitals which are protected in conflict zones. This is not a UN body. It was formed under the Geneva Conventions. We've asked signatory states to activate the commission and establish the truth and to reassert the protected status of hospitals in conflict zones. The commission is our best option for an independent investigation into the Kunduz case because it is the only body specifically for international humanitarian law violations. This commission does not investigate for criminal prosecutions or human rights violations. It is designed purely for humanitarian law. Though this body has existed since 1991, the commission has not yet been used. It requires one of the 76 signatory states to sponsor an inquiry. Governments up to now have never activated the commission. The tool exists, and it is time that it is activated for this purpose. Once activated, the commission inquires into the facts and investigates whether or not a grave breach or violation in the Geneva Conventions or Protocol 1 has occurred. A report establishing the fact is submitted to the parties of the conflict. The report is not made public unless agreed to by the parties to the conflict. In the case of Kunduz, we will push for full transparency of the findings. We are calling on President Obama to consent to the fact-finding commission. Doing so will send a powerful signal of the U.S. government's commitment to and respect for international humanitarian law and the rules of war. This is not only about the deaths of our staff and patients in Kunduz, it is about the safety and security of our medical teams around the world working in conflict zones. It is about our patients in Afghanistan, our patients in Yemen, our patients in Ukraine, and our patients in Syria. Today we are fighting back for the respect of the Geneva Conventions. As a medical humanitarian organization, we are fighting back for the sake of our patients. We need you as members of the public to stand with us to insist that even wars have rules. Thank you for your time, and I'm happy to answer your questions.
Spencer Ackerman with the Guardian. First, have you been able to secure any commitments from one of the 76 member states or signatory parties to the additional protocol to launch this investigation? And second, about the airstrike itself. Ahead of the strike, did any MSF personnel from inside the hospital receive any advance warning or notification from U.S. personnel or Afghan personnel that a strike was imminent?
We have not had any commitments thus far from any of the signatories to the commission. So I can tell you that. It's only been about 12 hours since we've officially requested that from the 76 states. We have not received any warning of a strike.
You had not received, to be clear, any warning? No one inside received any warning of a strike?
We did not receive any warning to our knowledge of an impending strike. It was calm inside the compound prior to the strikes.
So there was a previous, or the most recent notification to Afghan and American authorities was this 28th of September. Can you tell us why that notification was made in that instance? And was there not also an incursion of Afghan special forces into the hospital recently?
Yeah, so it was around September 29th. The reason that we reshared the coordinates of the hospital was because of the huge fighting that had been taking place and had started just days before. Just to keep in mind, we treated close to 400 wounded during the week before the strike happened. Yes, there was an incursion by Afghan Special Forces in early July, to which we loudly protested against. This is a key facet. When parties to the conflict do not respect the sanctity of our medical facilities, we protest loudly about that because it basically endangers our staff, because it runs the risk of creating this perception that this is somehow a facility that is militarized.
Had it been targeted by people in Kunduz?
No.
Sorry, in the back. You asked for transparency in the investigation, but don't you think it's also necessary transparency on the rules that the military is using to go with these attacks? Because obviously there is something missing here. If you give the coordinates, but they don't respect, it's necessary to know, to be transparent also on the protocols that they're following.
I think these are some of the questions that we would hope would be answered by an independent commission that we're calling for. I think it's very important for all of our teams working around the world and other humanitarian organizations to understand what protections they can expect from governments who have long-standing commitments to the Geneva Conventions and the rules of war, and then ensure that those commitments are actually realized when it comes down to it in the field. And so we have, I think, grave questions about these kinds of violations and what it means for the safety of our teams and for other humanitarian organizations working in conflict zones as well.
Hi, Aaron Kaczorski with ABC. What troubles you most about the U.S. accounts so far, and where has the U.S. fallen short, perhaps most, in its what it's told you?
Well, the accounts have been changing over days, and so I think it just underscores for us the need to have an independent inquiry. This commission has been tasked to do this. It's why it was established. It's why it exists. Unfortunately, it's never been used before, but we think it has the right sort of impetus and focus to get some of the answers that we all deserve, not just for our patients and staff who died, but I think for the work of humanitarian organizations in conflicts around the world.
Do you have any indication of when and how your staff members on the ground reached out to the forces during the attack? And did they reach out to U.S. forces or Afghan forces? Any responses?
Yeah, we reached out to both U.S. and Afghan forces. We received calls here in the U.S. When the attack unfolded, and we reached out to the same contacts that we had reached out previously to share the GPS coordinates of the facility. And that took place relatively quickly after the attack started.
And did you receive a response that you're aware of from either party?
At the time of the attack? We reached the people that we had shared the information with originally, so we were under the impression that it was being passed up to the chain of command.
Yeah. The U.S. government has said mistakes were made. Besides a call for transparency, what kind of accountability would you like to see?
For us, the main point of calling for this commission is really to establish the facts and whether to understand if, in fact, a grave violation of international humanitarian law has taken place and whether or not it amounts to a war crime. That's our main focus right now. There will be other inquiries, and I think our main focus is ensuring that this mechanism is triggered, that the commission can do its work, and that the U.S. government and Afghan authorities consent to it, because that is critical to it be able to be done. And we hope, even though it's an intent for it to be confidential findings, that those findings will be made public.
What about support for families, other staff members, anything else you're calling for at the moment?
We're not getting that into this moment. We're trying to provide as much support ourselves as an organization to our patients and our staff. There are still wounded who are being treated for their injuries in Kabul. They were transferred there, and of course we're deeply concerned for their welfare. But at this point, this is what we're focused on, and we will ensure that our staff is certainly taken care of as best of our ability. In the back, yeah.
Yeah, Joel Lauria from the Wall Street Journal. Since Nagasaki and Hiroshima, and through many invasions and coups and bombings, the United States and its allies can pretty much enjoy impunity when it comes to the question
We hope that the parties to this commission are going to stand up for the Geneva Conventions and ask, at least one of them, stand up and ask the parties to consent to this commission. I think that is at a minimum. We are at ground zero when it comes to respect for these rules of war. And it is incumbent, I think, on the states who sign these conventions, who supposedly respect the Geneva Conventions and the rules of war, to assent to this. I think there is nothing to lose from finding the facts to this. It's very important to the fabric of society generally and internationally, and also just how we can operate as humanitarian organizations in the field, providing treatment and care to the wounded and the sick.
Can you speak to the possibility of the presence of fighters in the hospital and whether that changes anything?
Yeah, we have, none of our staff has reported to us that there was any fighting inside the compound. They reported that it was quiet before the strikes. That's what we have. That's why we need this independent investigation and it's on the burden of the United States and other forces to substantiate those claims. And we think the best way to do that is with an impartial investigative body, in this case, this Humanitarian Fact-Finding Commission.
No fighting, no fighters? Were there fighters, were there Taliban fighters being treated at the time? Patients?
We treat victims, once a combatant is wounded, they are a civilian. We treat anyone who is a victim of conflict, regardless of politics, religion, ethics, political sides. That's what we do. That's our reason to exist. That's why most humanitarian organizations exist, and that's what's codified in international humanitarian law. So yes, it's very possible we were treating combatants, but they're not combatants anymore once they're wounded. The same could be said for American soldiers or any of the parties to the conflict, Afghan soldiers alike. So this is just a very fine, well-established and accepted principle that goes back as far as any laws of war have been accepted. And so we're just asking for a recognition of that, because that is just core to the fabric of how the rules of war.
Do you have any reason to believe
Yeah.
that the attack was an attempt to target anyone in particular who's being treated at the hospital?
Look, the reason we're asking for this commission is to establish those facts. We're not an investigative body. That's why we need this, and we need it to be done in a way that is not by a party that is involved in the fighting. And so that's their job. This is why the commission was established. We're not investigators. We are doctors and nurses who treat patients. That's it.
Are you planning on releasing a list of the victims, and also with regard to your lobbying efforts, I assume now, is there one particular signatory state you see as more likely to support you guys in your bid to get this up?
We haven't identified that there's one particular state in mind. That's why we've requested all of them, because they all can do this. With regards to the victims, yes, at some point we will release that. We are just in a process of ensuring that family members are notified. As you can imagine, given the circumstances in Kunduz and the fighting, it's not difficult. It's very difficult to reach everyone that we need to reach, and so out of respect for them, we're trying to complete that process, and the teams are working on that.
We're going to take 2 more questions. Anyone have any
In the
more
back?
questions?
When's the last time your organization has given the U.S. military its coordinates for the hospital?
We gave coordinates to them recently for Yemen. We passed coordinates to them in Yemen. We've passed to them in Syria. I mean, there are countless places that we've done this. It's a standard protocol for us. It's what we've done. Our safety is supposed to be our transparency of where we are and what our intent is.
What about for this specific hospital?
This specific hospital? Yeah, we had given them as recently as the September 29th and 30th of September, yeah.
Now, on that incursion by Afghan Special Forces in July, what response did you get from the Afghan government? What assurances that this wouldn't happen again, or explanation of why it happened? What level did that reach within the Afghan government?
I'm not sure exactly how good the response was. I mean, it's not the first time that we had issues in various places in Afghanistan. It's always been a challenge, I think, to just maintain respect for our medical facilities and for other organizations as well. It's hard to say. We've reaffirmed that dialogue with them after that incident, and they absolutely knew what we were doing. The fact that we had hundreds of patients had treated that past week, and we had close to 200 people in the hospital, staff and patients, and that it was an active, functioning hospital that should be respected and protected.
Thank you all.
Thank you very much.
have any other questions, you can see me or my colleague Tim Schenk, who's over there, and we can provide any background information.